So she
Recording
can
in
speak to what is
progress.
happening in the emergency department at MaineMed right now. And Chris Bovey from Midcoast Parkview can speak to what it is like there. He is a practicing emergency medicine physician, in addition to being the chief medical officer at Midcoast Parkview. So Pam, Ken, do you have permission? Looks like they do. So with that, Andy, I'm going to turn off my camera and turn it over to you for introductory remarks.
Sure. Thank you, Caroline. And, we're going to spend some time this morning talking about some real healthcare heroes, but I also want to just tell you how grateful we are for all of our heroes in the media who continue to sort of share the message of around where the pandemic is at and also continue to update us on all things. So we're grateful for all of your engagement today. So we got together several weeks ago to talk about some of the challenges we're facing as a healthcare system and just the challenge of the real national workforce shortage, which is impacting all of us with the rising numbers of COVID cases and then just incredible demand for other non-COVID services in our healthcare system and the strain that that's put on all of us. And so we made the difficult decision back then to reduce some of our non-emergent procedures and surgeries in order to preserve capacity for those patients who are most sick and really need acute care. And since that time, unfortunately, we have just continued to see an upward climb in the number of COVID patients, which has put significant additional pressure on our healthcare system, which is really making it difficult to provide the care that we need to for the entire community. And as much as we hoped we were wrong, this appears to be a fairly steady trend in result of the Thanksgiving holiday. And so we don't think we've seen the full brunt of this surge and probably won't for another 2 to 3 weeks. And then, of course, we fear that that will lead right into what will ultimately become a post-Christmas and New Year's surge as well. And so we've got great concerns about all of that. We've had to take some additional steps that you're going to hear about in a little bit, but I also think it's really important to point out that while this is not easy for everyone to hear, this really largely is a pandemic of the unvaccinated. The vast majority of our patients in our hospitals and healthcare system are unvaccinated with COVID-19. And this is especially true for those patients who are in our critical care units. And those critical care patients are challenging with COVID because they're very sick. They are here for an enormous length of time when they ultimately require intensive care. And they also require a tremendous amount of our resources to provide care for them. And we're happy to do that. And we'll continue to do that regardless. But the reality is when we step back and look at those patients who are in the intensive care unit, frequently 90+% are unvaccinated. And so there's continues to be good evidence, and we're seeing the results of it in our hospitals, that those who are vaccinated have significantly less risk of severe disease. Even for our non-ICU COVID population, on a typical day, it is somewhere upwards of 75–80% of those patients who are in our hospitals are unvaccinated. And so vaccination, including getting boosted, is critically important to all of us in really working with us to achieve our vision of working together so our communities are the healthiest in America. You're also going to hear about, as I mentioned earlier, how this is going to impact our ability to provide care and services to our community. We are doing every single thing we can to make sure that the most critical services are continuing, but that clearly is having other impacts throughout our system. We're also incredibly grateful for the support of our government counterparts. So the DHHS commissioner has been incredibly helpful in working hard to secure additional resources for us to ensure that we can both provide needed care for sick patients and also take steps to try to do those things that we know help reduce the likelihood that someone will ultimately end up in our hospitals. And so we're grateful for that support. We're also grateful for your support and the commissioner's support in partnering together around what is another pandemic that has occurred as a result of all that we've faced as a society in the last couple of years, which is really a behavioral health pandemic, where we continue to see unprecedented needs for the care of behavioral health patients that far exceed our capacity to care for those patients. And then lastly, as we think about all of this and what this has meant to our care team, I cannot tell you how amazed and inspired I am by all of them. These are absolutely incredible people who every day are putting their own health in harm's way, setting aside their own fears to provide incredible care for all in our community. And they are tired and they have worked so hard and they're continuing to hang in there despite the workforce shortage, despite the long hours, despite really sick patients who need lots of time, energy, and attention. They've just been absolutely amazing. And I can't tell you how big their hearts are. And so it is especially heartbreaking when so many in our communities who understandably are stressed, who are frustrated, who are concerned about the future, who are upset that some in our community are choosing not to get vaccinated and are equally upset that many in our community are asking them to be vaccinated, and understanding both the tremendous challenges and emotional toil of all of that debate. But unfortunately, so many are taking out their frustration on our care team, and it's just absolutely discouraging. And so we have had a number of care team members receive, just verbal threats and, just a lack of civility displayed for them. And in some cases, even physical violence just in the course of them trying to do their jobs. And unfortunately, it's just not helping. And it's making our workforce crisis even worse, as many, not only at MaineHealth, but in other health systems, are just saying, I can't do all that I'm doing if this is how I'm going to be treated. So certainly part of our message today is to really implore our community in a heartfelt way. Kindness matters. These are great heroes who are doing so much for all of us. Please do your part to be kind to them and respect them and know that they're doing their best to care for you. So with that, I'm going to turn it over to Joel Butler for some remarks.
Thanks, Andy. I thought what I would do is give a description of where Maine Medical Center stands, and particularly using a day earlier in this week. First of all, MMC is really at full capacity. There is really no more room at this point, and we're doing everything possible to increase that capacity. But the example of Monday really describes exactly what happened. So we had 50 patients at that time who had COVID. And at the same time, we had 10 patients who were under investigation for COVID. We had 16 patients in our ICU. We had 13 patients who were critically ill, but were not in our ICU. And the number that's quite high for us is that at that time, patients with COVID, we had 15 patients who were on ventilators. We had at that time on Monday, no capacity for us to take more ICU patients who had COVID. Our situation with non-COVID patients wasn't really any different. In our ICUs, we had 35 patients on ventilators. So that combination comes to, at Maine Medical Center, 50 patients who were on ventilators, when on average in the past, we might have 30 patients on ventilators. So really a dramatic change. The rest of Maine Medical Center on that day was also at full capacity. You'll hear from our ED doctors, but we were on diversion most of that day at Maine Medical Center. We had patients who were recovering from their surgeries in our recovery room who spent the entire night there. Both of those examples meant there was no flow at Maine Medical Center because of our capacity was overwhelming. And then to accentuate problems, none of our hospitals in the system had any capacity either. So the days when it was just Maine Medical Center full capacity, no one else, they're clearly over. During our last press conference, we talked about the reasons for this, but it's worth reiterating. Lots of COVID patients, labor shortages, patients at Maine Medical Center who don't have a place to go from Maine Medical Center. And the other exacerbating factor is many more of our healthcare workers either have COVID or are being investigated for COVID. So we might have on a given day 150 employees out with COVID. So in order for us to try to mitigate this and to try to improve where we are. What we have done is we have closed 6 more rooms in our operating room. So we previously closed 6 rooms, and now we are closing 6 more rooms. So this means that there'll be more patients who are having non-emergent procedures in our operating room that will be postponed at this point, probably to the tune of 25 per day. And the reason we did this is the goal was to increase the number of nurses and other staff to help open up 8 to 12 more ICU beds at Maine Medical Center so we could meet the need both for COVID patients and non-COVID patients who require ICU care. So this is what our initial plan is. Before I sign off, I do want to make 2 comments. Just like as Andy said, could not be prouder of the healthcare workers who are doing the work under very, very difficult circumstances. Everyone has really risen to the occasion, and the professionalism that we all live by and the values that we all live by have been maintained during these circumstances. And the final message is the best solution for this, the absolute best solution for this problem is vaccination and boosters. This is what's going to get us out of the current situation that we're in. So I want to pass this on to Dr. Ryan Knapp, who will have some more remarks.
Good morning. Thank you, everybody. So, I think I can just paint a different picture, but it's a related picture to what Joel just described. As a healthcare system, we work really closely together. And as a small hospital, we really rely on the resources that Maine Medical Center has for their expertise in subspecialty care and many advanced procedures that we just can't offer in a small hospital. So when Maine Medical Center is challenged, as Dr. Bottler had just described, that really affects us as well. So similarly, on Monday, when Maine Medical Center was in such a difficult position, we were feeling those difficulties as well. So our emergency department had 3 medical patients who are waiting to be transferred to other hospitals for a higher level of care, and we just couldn't get them there. And so when Maine Medical Center suffers, we suffer as well. Our 25-bed hospital has been running near or over capacity for the last several weeks. We're seeing that for a multitude of reasons, which Dr. Bottler just described, but we're also seeing that because of the burden of COVID in the rural communities that we're serving. When you look at how this pandemic has evolved, in the beginning of the pandemic, many of the COVID cases were coming from our more urban communities where there was a higher density of the population. And now what we're seeing is there's a significant burden in the rural counties like Oxford County, where our hospital is, that have very low vaccination rates, and therefore we're seeing very high COVID infection rates. Our test positivity rate locally has been as high as 21% in the last couple of weeks, which is far outstripped anything we've seen previous to the pandemic. Right now, just as of this morning, 23 of our 25 beds are filled. And the only reason we have a couple of beds is because we've had a couple people die in the last 24 hours. And we have 8 of those beds are taken up by COVID patients, and our entire small 4-bed ICU is taken up with COVID patients. This is putting a big strain on our staff. And as Dr. Bottler and Dr. Muller have described, our staff are rising to the challenge. They're coming in every day and working under very difficult circumstances, being asked to do more with less. And we really are doing our best to try and support them, and can use your help in the ways that they've both described in helping to support our staff. This has a lot of other downstream effects. Dr. Muller described the behavioral health crisis. We're all feeling that. It's really a crisis within this larger pandemic. There's just no capacity to get people the care they need for their psychiatric illness. So we're almost on a daily basis boarding patients in our emergency department who need behavioral health inpatient care and just can't get it. And this isn't just for a day or two, it's for sometimes weeks at a time. We also have patients who were trying to get to Maine Medical Center and just stuck in our emergency department just because there's no place for them to go at the moment. And this isn't just Maine Medical Center, it's across the state and even in other states where we've tried to see if we could get additional help. And they are all feeling the strain as well across New England. It's not just here in Maine. So I would just close my remarks as well with reiterating what Dr. Butler said. The best thing that we can have people do for us is to get vaccinated. And if you've gotten vaccinated and haven't gotten your booster yet, to go forward and get your booster shot. This really is a pandemic of the unvaccinated at this point, and we really need the help and need to take the strain off of our hospital, because otherwise we will continue to have to make difficult decisions about delaying non-emergency care even more than we've done already. Thank you.
Yeah, and Ryan, thank you for that. And I think, when this whole pandemic began, we talked about the need to flatten the curve, to everyone do all that you can to avoid overwhelming the healthcare systems. And the reality is we've got a really steep curve ahead of us. And so it's going to take all of us in the communities working together to really try to flatten the curve now, so that we can not only provide care for COVID patients, but also provide care for all the other patients and all of their other healthcare needs. So with that, I'm going to hand it back to Caroline, and I think we're ready to take some questions.
That sounds good. Thank you all. And I want to apologize. I don't think I mentioned that Dora Ann Mills is also on the call, available to take your questions. She is our Chief Health Improvement Officer at MaineHealth, obviously an expert on the virus. Many of you know her very well, also can speak to public health. So with that, I'm going to go in the order in which I received RSVPs. So up first is Blair Best from WGME News 13.
Hi, good morning. Thank you. My first question is, what do you have to say to those people who still choose not to get vaccinated?
Yeah, I think the first thing we say is, there is plenty of continued evidence that the vaccines are safe and that they're effective and that they really do work to reduce your risk of having severe disease, ending up in the hospital, and certainly ending up in the intensive care unit. And that right now, this is around taking care of each other. Your willingness to get vaccinated is helping others in your community as much as it's helping yourself. And so think about the others in the community. Think about the families that need our care for emergencies and other non-COVID related conditions that are going to increasingly find it challenging to get the care that they need in our community. And part of the challenge that we're facing now is, even several weeks ago, if we were at capacity, we could find places to send patients. Sometimes they were in other states, but at least we could find care for those patients. Now we can't. The hospitals in Boston are in the same situation we're in. Hospitals in other New England states, hospitals beyond New England are in the same situation we're in. And so any longer, it's not a matter of we may not be able to deliver care here, but we can send you elsewhere. It may be a matter of you're not going to find care anywhere. And so vaccinating, we know, is really the best strategies, the best weapon we have against this really awful virus. And so if you're willing to get vaccinated, you're not only protecting yourself, equally importantly, and maybe even more importantly, you're protecting others in the community and helping us preserve capacity to care for the entire community.
I just have one final question about the postponing of elective surgeries. What sort of long-term effects can that have on those patients?
Yeah, and Blair, I'll let Dr. Butler probably take this one, but I just want to make sure we're all clear on this. We call, sometimes they're referred to as elective surgeries, but they're not elective. These are not, for example, cosmetic surgeries. These are non-emergent surgeries. So these are people who need surgery. These are surgeries that are needed. But we feel that given the circumstance, these patients can make it another 90 days without putting themselves at risk for harm. Joel, I'll let you give a better answer.
Yeah, no, I think that's the right answer. These surgeries that we're canceling right now are things like joint replacements, like hip replacements, knee replacements, some spinal surgery. To be clear, though, these are all patients in a lot of pain. This is not, as we described, this is not elective surgery per se, but people who really need to have surgery done, who it's impacting their ability to work, it's impacting their ability to do their activities of daily living. so they can function at home. And so we know there are other surgeries which we're not delaying. There are cancer surgeries that don't need to be done today, but have major impacts on patients and their life expectancies. We are not canceling, and we definitely don't want to get to that place. But even the ones we are postponing, not canceling, postponing, are ones that have major impacts on people's lives. So it does get to what Andy was talking about in terms of the whole idea behind vaccination. It's not just about for yourself, but for your others around you, your neighbors, your families, so they can get the health care that they need.
Thank you.
All right, thanks, Blair. Up next, Patty White from Maine Public Radio.
Thanks. I've got two questions, and the first one I think is quick. Can you just give us an update on the percent of non-urgent surgeries you're postponing? Initially, it was 30%. It sounds like that's more. What percent would you say now you're postponing?
It's actually probably closer to 50% right now.
Okay. And in the backlog, I think in October was 1,500. I don't know if you have a number now of what the backlog is.
It's going to be closer to 2,000.
Okay. And this is I think the third press conference you've had about capacity issues and surges and hospitalizations. For people who've heard these concerns before and think, they may be thinking, well, we've heard this, but the hospitals have managed, they're making it through. What do you want them to know about what's different this time?
Yeah, there are a couple of things. So the first is, we have been able to manage. We have been able to move resources and think creatively, but we're starting to run out of ideas. And that's not because we're not trying to find them. We're listening to our frontline care team. We're talking to other healthcare systems across the country, trying to identify best practices. As Dr. Knapp alluded to earlier, working closer together as a system to ensure we're protecting capacity to provide care for those who are sick and really need it. We're running out of options, and we're seeing a trend in the virus that is upward. And so we're seeing a greater positivity rate in testing recently. We're continuing to see more admissions to our hospital and more visits to our emergency department with sick COVID patients. And we fear that it's only going to continue to get worse. And so if it does, it's going to put us in a significantly worse position. And so that's why we felt like we needed to talk to the community one more time to help people understand just how significant the circumstance is.
I was going to invite Christine Hind maybe to answer this question too, from what it's like in the emergency department right now and how it's impacting you there.
Okay, thank you, Caroline. I've been at Maine Medical Center for 21 years, and this is absolutely unprecedented times that we are experiencing right now. We've touched on a few of these things, but the real day-to-day impact of this pandemic, particularly of our patients who are not vaccinated, is that we are having boarding times in the emergency department, which is where a patient is waiting for an inpatient bed. And so they're occupying an emergency department bed that could be used for another patient, that are days to weeks. Most of our emergency department beds are taken up by patients who are waiting for an inpatient bed. And we do not have the ability to provide the same level of care in our waiting room or in a chair where we're seeing some of our patients or in the hallways as we do when we have space for them. So that, this is really truly unprecedented. We've been managing this pandemic for almost 2 years now, and it's coming to a point that I think we all fear we're going to be making some of the difficult choices that we were concerned about at the beginning of the pandemic. This leads to prolonged wait times to be seen in the emergency department. And when you don't know why somebody is in the ED, that is increased risk for them. So the sooner we can see people, the better they'll do. And we're running out of spaces to isolate patients who have COVID, who come to the emergency department and need to be seen. There are days where we don't have any more spaces to put patients in an isolation room. And that obviously creates a risk to other patients and staff. And so we're working very creatively to improve this on a day-to-day basis, but the best thing that people can do is get vaccinated.
Thank you.
Up next is Joe Lawler from the Portland Press Herald.
Yes, hi, thanks so much for doing this. Um, just a follow-up on a couple of things. Dr. Butler, you were mentioning 6 operating rooms that you're freeing up. Were those operating rooms for specific types of surgeries, or were they just a general surgery? And can you explain how opening 6 operating rooms creates 8 to 12 more ICU beds? Thanks.
Yeah, those are good questions. Those operating rooms can be used for a variety of things, so they're not very specific. But the way it works is there's 2 things. You know, we require people, be it the CRNAs, the advanced practice nurses who provide anesthesia, potentially operating room nurses, or the recovery room, or what we call PACU nurses, who can all be redeployed to work in ICU level care. So part of what our problem is, we mentioned, is labor shortages. So this is a method, not a preferred method, but a method of getting more people to do work. So that's one area. The second thing is, if you can imagine that we're recovering less people in our post-acute units, we then can convert those units into ICU type places. So that's what we're doing. We have enough people by doing these cancellations so we can provide ICU care, and it affords us more space that we previously didn't have to actually provide it.
Thank you. Are there different types of surgeries that you are postponing than you were previously or will be?
It's not necessarily different, it's more of it. So we postponed a lot of our non-emergent joint replacements, but now we're postponing all of our joint replacements. We postponed urogynecologic cases. Now we're postponing almost all of those. So it's much more that we're taking the similar types of cases and we're postponing more of them.
Okay, and then just one more clarification from Dr. Knapp. You mentioned that 2 people died, and that's the reason why you have 2 openings. Were those people, did they die of COVID?
I think probably getting into too much patient detail in a small community like ours is probably not the best idea on a call like this. But it's definitely a challenge every day with managing many cases, not just our COVID cases.
Thank you.
Next, we have Hannah Deneen from New Center, Maine. Hannah, you on the call?
Sorry, I've been getting a bit of an audio issue. For Dr. Muller, you discussed how the hospital system has been sending patients to other hospitals, even as far as Boston. And you also talked about running out of ways that the hospital is getting creative in order to meet the needs of these patients. Can you describe, even just anecdotally, I mean, what sorts of ways has the hospital system been getting creative per se in finding beds for these patients and caring for this kind of capacity of patients?
Yeah, I'll start at a high level. I'm happy to let Dr. Butler or Dr. Knapp or others jump in as well. But, there are a number of things that we've tried to do. So we've really tried to be thoughtful about how our entire workforce is being used to care for the sickest patients, make sure we're prioritizing the right things, and in some cases, prioritizing some care delivery to keep people from needing to be hospitalized. So that includes providing support for monoclonal antibody therapy in some of our facilities. It means doing what Dr. Butler described earlier, having to think carefully about our ability to provide safe surgery at the expense of not being able to provide care for acutely sick patients who are in demand right now. And so managing that. Our teams have done an incredibly good job of creating sophisticated dashboards to monitor capacity across our system so we can see where some hospitals have availability and others don't real time. And our chief medical officers, Dr. Bovee, Dr. Knapp, and Dr. Butler and others have worked really hard together to identify where we can care safely for different levels of patients across our system So we can preserve some of the most high acuity care at Maine Medical Center, capacity Maine Medical Center for that really high acuity care to allow that to occur. And then I'll certainly let any of the other providers jump in with some.
Yeah, I'd be happy to jump in, Dr. Muller. We actually have a system capacity call that we include the chief medical officers, the chief nursing officers at all MaineHealth facilities. We have that on a daily basis, and often we pull that together on the weekends. And we find out if there's capacity at any of our systems. And patients are not used to being transferred here at Midcoast. They're not used to being transferred to Stevens, but at times we transfer patients to Stevens if they have an available bed. And we work very hard as a system to identify where's the next bed for a patient who needs it, not just default to Maine Medical Center, because Maine Medical Center has been so very full and we need to save those beds for the sickest of sick patients throughout the state. So there has been a very coordinated effort that people have worked very hard to maintain so that we can continue to move patients to a care setting where they can get the care they need, and we can maintain some capacity for the next patient who's coming in.
I would also add that many of the smaller hospitals have worked to expand the capabilities of what we can care for in the smaller hospitals. So, for example, in the beginning of the pandemic, we really pretty much transferred every COVID patient to either Maine Medical Center, Midcoast, where Dr. Bovee works, or Southern Maine Medical Center to try and focus our COVID resources. Now, all the small hospitals are taking care of COVID patients. And not only are we taking care of COVID patients, we're taking care of sicker and sicker COVID patients to the point where we're taking care of ICU level COVID patients now in some of our smaller hospitals, which we were not doing earlier on in the pandemic. So we've grown our capacity in the acute care arena to be able to try and meet some of these capacity demands so that we could save beds at Maine Medical Center for the things that truly only Maine Medical Center could be caring for. And the other thing I would say is, you know, if you're a patient and you show up in Norway in our emergency department, we may transfer you to Franklin Memorial Hospital up in Farmington, or transfer you over to Memorial Hospital in New Hampshire, because that's where the bed is. And that's what Dr. Bovee was talking about, with us getting together and really looking as a system, where are our beds and how can we get patients to those beds.
And, you know, and one of the other things we've done to let Dr. Mills speak to is really focusing additionally on how do we thoughtfully try to tamp down spread of the disease across our communities. We recognize that the population in which we are seeing the greatest degree of spread is really among those individuals in our community under the age of 20. So Dora, do you want to talk about some of our school-based vaccination efforts?
Sure, thank you. Yeah, and you know, besides caring for some of the sickest, probably most of the sickest patients with COVID around the state, we're also working very hard to prevent COVID, as well as to identify and treat the disease early. So for instance, over the last 4 weeks, MaineHealth has administered over 12,000 doses of vaccines to about 9,000 children ages 5 to 11. And most of these are being administered in 120 elementary schools during the school day. We're also providing booster shots and, of course, first dose vaccines for anybody else as well through our practices and also some public clinics. I also should mention that our lab, Nordics Labs, is running about 4,000 to 5,000 COVID tests per day. And the peak last winter was about 3,000. We've also stood up monoclonal antibody infusion centers that are administering about 200 of these treatments per week. And we're increasing our capacity for that every day. This medication, when administered early, prevents hospitalizations in those who are at high risk for severe disease. So, you know, we at MaineHealth are working hard on all fronts to address this pandemic throughout our communities.
Great. Thank you, Hannah, for the question. I want to go to Jim Keithley next from WMTW News 8.
Thank you, Caroline. Thanks for taking my question. We were curious, we're talking about early on in the pandemic and contingency plans that included talks of, you know, converting the Cross Insurance Arena in Portland, for example, as an overflow site. I guess I wonder, we were talking this morning in our morning meeting, you know, have we tipped the scale and are we there yet, or is that even still on the table? I mean, when you say the hospital, at least at Maine Med and pretty much everywhere else, is at capacity, I mean, what is the contingency plan for these sort of off-site overflow areas?
And that's sort of the crux of the problem, because the challenge we've got is not finding space. The challenge we've got is finding qualified healthcare workers, because they don't exist. Our nation has lost over 500,000 healthcare workers who've resigned, retired, left the field in the last several months. And so there's a huge workforce crisis across our country. And so the problem we have is not space, it's bodies. It's the availability of healthcare workers to staff something like that. So even if we didn't have physical room, if we wanted to expand, we're not going to have nurses, doctors, phlebotomists, respiratory therapists, all of these critical care team members who are so important in delivering this care. And so that's really not an option anymore.
So as far as the contingency plan being converting some operating rooms, what else is part of the contingency plan to address what's happening inside these hospitals?
Yeah, so this is something that's going to face the entire country right now, to be clear. It's not just us. And that's why we're starting to run out of options collectively as an industry, not just MaineHealth or Maine Medical Center. So we're going to continue to try to prioritize how we deliver care, how we can try to work through things the best way we can. And that's at every level. It's rethinking how we can provide the best care in an outpatient setting for some of the behavioral health patients who present to our emergency departments or to our hospitals. It's trying to figure out how we can try to move patients more smoothly through our clinics. It's some of the work that our physicians have done in expanding access to their clinics outside of the hospital to try to reduce some of the burden of the emergency departments that Dr. Hine and Dr. Bovee spoke to earlier. It's really trying to redesign how we're delivering some of this care to give us the maximum capacity we have. And clearly, we're doing everything we can to augment our team with additional temporary labor and other things, but recognize every single healthcare system in the country is in this circumstance. And so there are presently 30,000 posted unfilled traveling nursing vacancies across the country. And so it's just unrealistic to think that we're going to have the ability to bring in a rescue workforce to help us here, although we would love to have that happen.
Thank you.
The other thing I want to add is what's different between now and March of 2020, when we made our original contingency plans, is we didn't have so many people who had all their problems delayed. We didn't have patients with delayed surgeries or with delayed management of their chronic illness. So we've all noticed, all our ED doctors, that the severity of illness walking into our hospital is much greater than it was in March of 2020. And it's a tension and it's a difficulty that we're going to face now. So there simply is not a readily available good contingency plan that we are very confident in.
Yeah, and just to add on to what Dr. Butler said, a lot of this for sure is in delayed care. People who, for appropriate reasons, didn't get care last year and are now having complications of that or need the care now. A lot of what we are seeing, I assure you, is also the physical manifestations of stress, anxiety, and exacerbation of underlying behavioral health conditions as well. And that's not just because of the stress of COVID, but the stress of everything that we've all been under the last couple of years. And so that too is resulting in more people showing up in our hospitals, emergency departments today, seeking care. And that's going to continue for a long time.
All right. Next up, Patrick Whittle from the Associated Press.
Thank you so much. I had a couple of things. I wanted to start by double checking a statistic. Dr. Butler, I believe you said earlier that is it 50% of surgeries are being postponed, or actually, I think that might have actually been Dr. Muller.
No, it was me. It was, yes.
Oh, okay. So it's 50% of surgeries at Maine Med are currently being postponed.
Right.
Right. And that's the high watermark for the pandemic.
Well, the high watermark was in March of 2020 when we first started, and absolutely canceled essentially everything except for emergent surgery. So, but it's a high mark since the spring of 2020. Yes.
Right. I see. Question for everyone: is there a median age or a mean age of the patients that you're seeing these days? Because in the latter stages of the pandemic, that seems to have trended down, but I'm not totally certain what we're seeing in terms of age of hospitalized patients and critical care patients at this point.
Happy to take that. I know we have many more patients in their 50s in our ICU than we ever did during the pandemic. So in a recent snapshot of this, our average age in our ICU for COVID patients was in the 50s. So it's a dramatically different population. And the other part about that's unfortunate is the severity of illness of those in our ICU is the greatest that we have seen since the onset of the pandemic.
I can jump in here as well. I worked a stretch of shifts over the Thanksgiving holiday and weekend. And when I went home, I told my family I hadn't seen that many COVID patients as I did in those 4 days in the previous several months. On my last day, it was 1 of every 2 patients I saw was there for COVID. And it's a much younger patient population. And as Dr. Butler mentioned, the sickest patients that we've been seeing. So people in their 20s and 30s who are requiring ICU level of care, ventilatory support, with no other real existing disease to account for that other than severe COVID.
I would second that. At Midcoast, our patients in our ICU, right now we have 6 patients on ventilators, for 5 of them with COVID infection, which is a high number for us. We have an 11-bed ICU. And the age of the patients with COVID who are requiring extensive care, proning, where it's the situation where you turn a patient onto their stomach to help expand their lung capacity even while they're on a ventilator. It's challenging to do, but it provides some benefits in some patients. We've been doing that with our patients, but we've had a large number of patients in their 40s and even younger in our ICU on ventilators with COVID, which is unlike what we experienced in April and May of 2020.
I would just add one comment that this isn't an academic exercise when we talk about vaccination and the benefits of vaccination. The reason we're seeing a lower age group getting sicker is because the vaccination rates in those age groups are much lower. So earlier on in the pandemic, we saw much higher morbidity and sickness in the older age groups because they were the highest risk, but they now have the highest vaccination rate of anyone in the population. So we're seeing them, relatively speaking, less than those in the younger age groups with lower rates of vaccination. So this is a real, for those of us boots on the ground, what you see in the statistics, we feel every day when we come to work.
All right, up next, Dustin Vlodkowski from NECN.
Thanks, everybody. My first question is, if we had an event with a lot of people who need care in Maine at once today, a bus or train accident with dozens or 100 critical injuries, a building collapse with 100 or more people in need of emergency care, would you at MaineHealth hospitals be able to handle that?
I'm gonna look to one of my chief medical officers.
Okay, I didn't want to keep talking, but yes, we would have to handle it, and we would put in place. We have a disaster plan, and we would move some of our remember, we said we probably have between 50 and 70 patients at Maine Medical Center today who don't require being at Maine Medical Center. So we would emergently find a space for them, move those patients, and we would take care of the critically ill patients. So but that would be our approach, and we would do that.
And I think we have a real life example of exactly what you're asking when our colleagues at Stevens had an event that we suddenly needed to move patients out of the hospital. And Dr. Knapp can speak to it better than I, but I think, again, the systemness and the cooperation that's been happening through healthcare systems is that if somebody says, I need you to take 10 patients because of an emergency, we're going to find a way to take 10 patients. And if that involves canceling, colonoscopies, canceling other studies that people were coming in for, that's what we would have to do. But we would make that work.
Yeah, and I think the most important word in our vision statement of working together so our communities are the healthiest in America is the word together. We can't do it alone, and we recognize that. So I've had conversations this week with a number of other health system leaders across the state and region. We're continuing to stay in close contact, and we're going to need to rely on each other to help in significant situations to ensure that we're doing everything we can across the state and region to provide the care that we need to.
But it sounds like it would be more difficult than it ever has been before to try and do something like that.
Everything is more difficult than it ever has been before, which is the real challenge. And we don't see it getting any easier as COVID numbers continue to rise. It's just going to get more difficult, which is why we're really asking for the community's help. We need it.
Now, is there a specific example you could give of a procedure you couldn't provide because of capacity that then when you looked for it somewhere else, somewhere for the patient to go have it done out of state or something, that then there was no room in that other spot either?
So far, that hasn't happened. One situation that was discussed is we frequently hospitalize patients with acute leukemia for several weeks. And we went through a process very recently where we said, if our capacity was so constrained that we could not admit those patients, where could we do that? So we reached out to Mass General and we asked them if they could take those patients, and they said no. So that's the kind of situation we're in. So obviously, we would figure out how to do it. We would have to take care of that patient, but it is an example where we could run into problems. And that would probably extend to other areas where we have been successful today, but wouldn't necessarily be successful in the future.
And to go back to another hypothetical, I don't mean to keep asking about them, but is there a point where somebody else like the state with specifically recruited people should take over the responsibility for caring for COVID patients and take that off your plate? And would something like that make sense?
So we would welcome it. We would love it. And I just think the reality is it doesn't exist. I don't know that the state can manufacture individuals to do this either. And the harsh reality is that even if we don't have medical units attached to our National Guard teams in Maine and New Hampshire, and so that resource doesn't exist. Even if it did, even for example, if military reservists who are medically trained were called in to help us, we're taking them from other areas where they're incredibly short-staffed, and we're just going to exacerbate the problem elsewhere. And so that's the point that we're trying to get across to everyone. We're running out of straws. There are not a lot of great options left. We are fortunate to have the incredible healthcare team and workforce that we have in our communities and our health system. These are amazing people who are incredibly talented and well-trained, but they need your help right now. And they need everyone to get vaccinated, and they need everybody to be kind to them, knowing that they are working incredibly hard in difficult circumstances to try to provide care in a heroic manner to everyone that we serve.
And then lastly, has the state or federal government said it has some semi-concrete answers to recruiting the people that you do need?
Yeah, they're just, I don't know how you'd make up people in the short term. And so to be clear, while we are trying to figure out how we can ensure that we've got as much of a team as we can to provide care for the regions we serve. And we've had great conversations in partnership with our state and local elected officials who've been incredibly supportive and helpful in doing what they can. And at times they have loaned us, for example, some public health nurses to help us provide monoclonal antibody therapies and expand our capabilities at some of our facilities. We've been super grateful for that help. And at times those individuals have to be redeployed to give vaccines to help ensure that we're trying to minimize the spread of the disease in our communities. And at the same time, again, there's not going to be any easy answers out there. There's just not this untapped workforce that we can bring in to make all of this better, which is really, really hard.
All right, thank you, Justin. And Steve, I am getting to everybody's questions, so I'll get to yours when it is your turn. Pam Harnden is up next from the Franklin Journal and the Livermore Falls Advertiser.
Actually, this is my first time sitting in on one of these, so I'm learning lots from the questions from everybody else. So I will defer to the next person on the list. Thank you.
Perfect. Thank you. Thank you for keeping things moving here. Next person on the list is David Marino from the Bangor Daily.
Thanks so much. Dr. Muller, you mentioned that using the cross insurance arena was kind of untenable due to staffing issues. What happens if the hospital system actually does become, completely overwhelmed? Could we see the possibility of a crisis standard of care like that, which has been seen in states like Idaho and Alaska?
Yeah, if we get to that point, and I don't think that any of us believe we're quite at that point yet, we still have some capacity in our facilities, and some of the other health systems in the state have some capacity, although it's significantly reduced. And part of why we want to try to deliver this message today is we hope we don't get into that circumstance, but at some point, if we continue to see the demand for the high acuity care that we are, then we'll have to have conversations about that for sure.
Great, I appreciate you answering that. And my second question was, you talked about staffing shortages generally. Are there any particular positions that you're seeing short-staffed right now? I've heard a lot about nurses, but I was wondering if there were any specific kind of fields or any positions that just don't have enough people right now at your hospitals?
All. So if any of you are interested in filling out an application and coming to work for us, we would be happy to have you join the MaineHealth team and provide care for our communities. So yeah, it's really all. And so in addition to all that we're doing in the short term to try to figure out how we can continue to support our team and make sure we've got a team that's large enough to provide care for the community, in addition to the conversations with our elected and appointed officials at the state, both here and in New Hampshire, we're also having lots of conversations with our institutions of higher learning, our community college system, about doing everything we can to, as quickly as possible, expand capacity for training the next generation of nurses and respiratory therapists and imaging technicians and all the other professionals that we're going to need to provide care for our communities for years to come. Because the reality is, as hard as it is to say, the national workforce shortage crisis that we're facing, it's going to be here for years. And so we've got to do everything we can to home grow the next generation of healthcare professionals here in the states we serve.
I just had one final thing. One thing I haven't heard in this discussion is, the Omicron variant. Do you think this could change things rapidly, or is this in your planning? Just my final question. What do you think this could do to this already tenuous position that you were in?
I don't think we have a good. I'll let Dora's the expert. I'll let her chime in, but I think the honest answer is it's too soon to tell.
I agree with Andy. It's too soon to know. It is very concerning. Even if it causes milder disease but we already know it's much more contagious. It just means that there's potentially a lot more people who will get sick with it, even if most of them are mild, a very small proportion of them becoming sicker and needing hospitalization means a lot higher numbers of people with COVID who need hospitalization. So, but it's too early to tell. I've got our fingers crossed though.
Right. Next, Linda Clancy from the Penn Bay Pilot.
Hey, thanks so much. Appreciate your illustration of what's going on at the different hospitals, Maine Med and Stevens. I wonder if you could tell us what's going on in the Mid-Coast, give us a snapshot, Waldo County, Penn Bay, and Miles. Thank you.
Yeah, I'll start. Oh, and Chris, actually, you go ahead and start. That'd be great.
Sure. Just from our shared conversations on a daily basis, the volumes fluctuate at all of those facilities with the rest of us. So there are certain days that Penn Bay has been able to have some capacity and take admissions from Maine Med or Mid-Coast here in Brunswick or our colleagues at Stevens. And then there are other days when their capacity is stretched thin and they need to send patients to us. And that availability for the next available inpatient bed for a patient who needs it has really floated throughout the system of each day, which region has a few beds available. They've been wonderful partners of being able to take patients, and then when needed, we've been all able to help each other and help them as well. They have postponed cases similar. Many of us have all done the basic postponing of cases of patients who would need to be in the hospital after surgery. An elective case where you need to stay in the hospital, it's very difficult to proceed with those when the hospital beds are in such demand. So we've been in similar situations about what we've postponed on those types of cases. And our colleagues at Penn Bay, Waldo, and Miles have done the same with us.
And Steve Betts had a similar question. Steve, I don't know if you have an additional question that you wanted to ask since Linda asked your question.
Nope, that's the question. Thank you.
All right. Last question of the day goes to, if he has one, is Bill Nemitz from Portland Press Herald.
No, thanks, Carolyn. I'm all set. Thank you all very much.
Great. Okay, so I think that's it. And I don't know, Andy, if you have any closing remarks. I did just want to let our friends, particularly those who rely on visuals to tell their stories, that we will, when we send our press release out, we will have some B-roll from Maine Medical Center's emergency room to help you tell your story. So just be on the lookout for that. I guess Joe Lawler would like to ask one more question. We do have time for one last question. So Joe, I will give you a chance to do that.
Hi, can you hear me?
Sure can.
Okay. Yeah, this question is for Dr. Hine, actually. So can you just kind of, in your own words, describe what it's like caring for an acutely ill COVID patient, maybe one who's on a ventilator? What is the patient experiencing, and what are you as a doctor experiencing?
Thank you for that question, Joe. I've thought a lot about that, obviously, in the past many months, and the emotional toll is significant for the staff. One of the unifying themes amongst the healthcare team is that we went into this work because we want to help people. And when you are faced with delivering the news that somebody has severe advanced COVID, the first thing they ask you is, okay, so what's the plan? And the answer is pretty disappointing, because the answer is the plan was that you hopefully could have gotten a vaccine that would have prevented the severe disease. And of course, we don't say that at that moment, but that's the most effective strategy. And there's this incredible really distress that develops from knowing that and having that knowledge, and having compassion for the person that's in front of you, and thinking about their family and friends and what their disease is going to present to them for challenges if they do survive it. We spend a lot of time talking about mortality of COVID, but we don't talk about the morbidity, which is the long-term health consequences associated with it. And so those are all the things that go through my mind when I'm taking care of somebody with severe disease. And it's very distressing. I think about them for weeks to months after each one of those encounters, and wonder how they're doing, and check on them and see what their course has been. So I have a lot of gratitude for my colleagues who are doing this work. I think they're a very dedicated team of individuals, and I have the utmost respect for everybody, including our leadership, who has continued to try and prevent, to create new strategies and ways to flex and expand and surge, given what is facing us.
All right. Thank you all very much. I was just checking to make sure that Ryan wasn't about to say something. It's just like the bigger group is just coming back. So thank you all so much for joining us today. And hopefully you have everything you need to tell your stories. And we really appreciate your taking the time to talk to us.